Contaminated Medicines Crisis. WHO report reveals toxic threats to children. The hidden dangers of contaminated medicines. A global health crisis. Imagine a world where the medicines meant to heal you could actually harm or even kill you. Unfortunately, this is a harsh reality for millions of people around the world, particularly in low and middle-income countries. The World Health Organization, WHO, and the United Nations Office on Drugs and Crime, and UNODC, have just released a landmark report that exposes the shocking truth about contaminated medicines and the devastating impact they have on patients, especially children. A persistent and preventable threat. Over the past 90 years, at least 25 documented incidents of excipient contamination have resulted in more than 1,300 deaths worldwide, many of them children. These incidents occur often due to systemic vulnerabilities in the global supply chain of pharmaceutical excipients, and they've perennially disproportionately affected people in low and middle-income countries, LMICs, where regulatory oversight and access to quality-assured medicines may be limited. The tragic consequences of contamination. The report highlights a tragic and ongoing public health crisis, the contamination of medicines with industrial-grade toxic chemicals, notably diethylene glycol, DEG, and ethylene glycol, EG. These substances are used as industrial solvents and antifreeze agents, but can cause severe health issues and be fatal if ingested, even in small amounts, especially for children. They are often illegally substituted for pharmaceutical-grade excipients such as propylene glycol, glycerin, and sorbitol, ingredients used in the formulation of medicines. Deadly contaminated medicines. Over 1,300 deaths worldwide. Shocking report. Imagine a world where the medicines meant to heal us can actually harm us. Sadly, this is the harsh reality for many people around the globe. A staggering 1,300 lives have been lost due to contaminated medicines in the past 90 years, with at least 25 documented incidents of toxic chemical contamination reported worldwide. But here's where it gets alarming. These incidents are not isolated, and they're happening in countries where regulatory oversight is limited, such as Nigeria, India, and other low and middle-income countries. The World Health Organization, WHO, and the United Nations Office on Drugs and Crime, UNODC, have joined forces to release a landmark report, Contaminated Medicines and Integrity of the Pharmaceutical Excipients Supply Chain, which sheds light on this ongoing public health crisis. The report reveals that industrial-grade toxic chemicals like diethylene glycol, DEG, and ethylene glycol, EG, are being used to manufacture medicines, particularly liquid oral medicines, which can be fatal if ingested even in small amounts, especially for children. These substances are often illegally substituted for pharmaceutical-grade excipients, and the consequences can be devastating. For instance, since October 2022, the WHO has issued 7 medical product alerts concerning multiple batches of contaminated liquid oral medicines, many of which were marketed for pediatric use and exported widely to low and middle-income countries. And this is the part most people miss. These contaminated medicines are not just limited to black markets. They're also available in pharmacies, medicine stores, and informal street markets. The report highlights the need for urgent global action to close regulatory gaps, strengthen oversight of excipient supply chains, and protect all populations, especially the most vulnerable, such as children, from preventable and deadly poisoning. But here's the controversy. While some argue that stronger regulations are the answer, others believe that the problem lies in the lack of cross-border cooperation and investigative capacity. The UNODC draws attention to the criminal aspect of the problem, describing how organized crime groups are exploiting the global pharmaceutical supply chain with hazardous and unregulated substances. So we have to ask, what can be done to prevent these tragic incidents? Is it time for a more robust regulatory framework, or do we need to rethink our approach to cross-border cooperation and law enforcement? The report emphasizes the importance of strong and effective medicines regulatory systems to ensure access to safe, effective, and quality-assured products. As we move forward, it's essential to consider the role of international legal instruments, such as the United Nations Convention Against Transnational Organized Crime, UNTOC, in combating the illegal trade of contaminated medicines. The question remains, how can we work together to prevent the contamination of medicines and protect the lives of millions of people worldwide? We invite you to share your thoughts and opinions on this critical issue in the comments below. Urgent action needed. WHO warns of toxic medicine contamination. A dire warning has been issued by the World Health Organization, WHO, highlighting a critical and ongoing public health crisis that demands immediate attention. The issue revolves around the contamination of medicines with industrial-grade toxic chemicals, posing severe health risks, particularly to children. The WHO specifically targets diethylene glycol, DEG, and ethylene glycol, EG, substances commonly used as industrial solvents and antifreeze agents. These chemicals, when ingested, can lead to severe health complications and even prove fatal, especially for children. The problem arises when these toxic substances are illegally substituted for pharmaceutical-grade excipients like propylene glycol, glycerin, and sorbitol, which are integral ingredients in the formulation of various medicines, including cough and paracetamol syrups. In a joint report with the United Nations Office on Drugs and Crime, UNODC, the WHO unveiled shocking findings. Over the past 90 years, at least 25 documented incidents of excipient contamination have resulted in a devastating toll of over 1,300 deaths worldwide, with a significant number of these victims being children. The most recent tragedy occurred in the Gambia, where at least 66 children lost their lives, followed by similar incidents in Indonesia and Uzbekistan, claiming a further 268 lives. The WHO attributes these incidents to systemic vulnerabilities in the global supply chain of pharmaceutical excipients. These vulnerabilities disproportionately affect people in low and middle-income countries, LMICs, where regulatory oversight and access to quality-assured medicines may be limited. The report further exposes the tactics of criminal networks who exploit market volatility and regulatory gaps to introduce toxic substitutes into the supply chain. This includes the use of falsified labels and the substitution of toxic chemicals for legitimate excipients, as well as the marketing of falsified excipients via online platforms such as e-commerce and social media. The WHO calls for urgent global action to address this crisis. They emphasize the need to close regulatory gaps, strengthen oversight of excipient supply chains, and protect all populations, especially children, from preventable and deadly poisoning. This issue demands our immediate attention and action to ensure the safety and well-being of vulnerable populations worldwide.